Hello, I'm Lindsay Edwards. I'm faculty in the Division of Counseling and Family Therapy at Regis University in Denver, Colorado. On behalf of my co-authors, Dr. Anibal Torres-Bernal, Shannon Martin, and Scotty Hanley, I would like to tell you about our study that was recently published in Family Process under the title Resilience Factors and Suicide Risk for a Sample of Transgender Clients. For this study, we were interested in exploring what we have called a resilience pathway, which we believe is protective for some in the various transgender communities. Specifically, our aim for this study was to test the mechanism through which individual and community-based resilience factors might operate together in order to decrease transgender clients' risk for suicide. We consider this work to be complementary to a body of research that has used the minority stress model, which was created by Dr. Elon Meyer in 2003, as a framework for studying the increased health risks experienced by transgender communities. This body of research has been focused on better understanding the three pathways through which transgender people experience minority stress. The first pathway being through the experience of direct discrimination, the second being through the anticipation of encountering mistreatment like discrimination, and the third being the internalization of negative societal beliefs associated with one's identity. This research has overwhelmingly shown that the experience of discrimination is significantly associated with higher rates of suicide risk for transgender communities, essentially supporting Elon Meyer's theoretical framework. What's more, however, is that a number of these studies have shown that individual-based stressors, like internalized transphobia, for instance, mediates the effect that community-based stressors, like discrimination, can have on mental health outcomes. We call indirect effects like this one pathways of risk in our article. But our thinking was that where there is stress, there is also resilience, strength, and growth. As interventionists, we are most interested in what works. So rather than explore how factors operate together to increase risk, we were primarily interested in what factors would operate together to decrease risk. In a review of current literature, we found that factors like emotional stability and a supportive network of family and friends, which we call relational support, separately predicted decreased risk of suicide for transgender people. Following a similar line of thinking with regard to pathways of risk, we thought that individual-based resilience might mediate the association between community-based resilience and reduced risk for suicide in a sample of transgender clients. We were proposing a pathway of resilience. Specifically, we thought that the effect relational support had to decrease a person's risk for suicide would happen indirectly by first impacting that person's ability to regulate suicide-related thoughts and behaviors during moments of psychological distress. Our findings showed that this was indeed the case. To us, this has a number of very important clinical implications. As just one example, we see this as indicating that it is important for clinicians to know that their efforts to foster relationship support for transgender clients are a critical focus for therapy. This is because relational support operates to increase a client's emotional stability, ultimately decreasing their risk for suicide. We present this and other important clinical implications stemming from our research in our article, and we hope that you will check it out. Thank you.